Thank you, Annette. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Before I start the presentation, I just want to remind people that suicide prevention doesn't sit in isolation. It sits within an overall context of what we might call promotion, prevention and early intervention in terms of mental health and well-being. And that really does require a whole of community, let alone a whole of government approach. But having said that, let us remind ourselves, if I can work why we are actually wanting to address suicide prevention here in New Zealand. As you can see from that graph, while we have had some drop from the high years, we still have a stubbornly high suicide rate in this country. It is, I think, a serious matter of concern in terms of public health, and when compared with other OECD countries, the male suicide rate in New Zealand is towards the middle of the range, and the rate for females is in the top third. So we've got some ways to go. The rate of suicide among young people and Māori are particularly concerning, and we'll hear some more about that, I see, from speakers on the program. And around 20% of suicide deaths are in the ages of 15 to 24. And of course the suicide rates for Māori is 5 times greater than the non-Māoris. So in this context, we can't just sit on our hands and do nothing. We actually have to collectively, in a collaborative process, do some work together. What you see in that graph is in fact from the suicide facts for 2010. We're still working on the next year's process. Just to remind us of some of the population groups which are showing up in our stats with a greater risk, and they really are quite diverse, so that it's hard to say that there is one group. If we made a big difference in that group, it will make a change to a suicide rate. So we actually have to think systemically and think across the board in terms of where we need to intervene. Government has had a suicide prevention framework now, it's really going back to 2006, and you see a slide there that shows a number of our previous iterations of this, and the current framework or action plan actually sits within that overall strategy which runs through to 2016. In May of this year, if I can work this, the one at the end, was released as the action plan for 2013 to 2016, and it really does build upon the overarching strategy of the previous plans and the previous investments in terms of what we're doing. Funding has been earmarked over 4 years for this, for the 30 actions within the plan. For those of you who haven't seen this plan and want action plan and want to get copies of it, it's available through the Ministry of Health's website. Just go health.gov.nz and search for suicide prevention, and it comes up easily. I really would like to acknowledge a number of people who here in this room have actually made some contributions to the development of this plan. So, what are our goals in this suicide prevention strategy? And I just want to go through those very briefly. I'm aware of time, so I won't dwell on them, but just to remind you of what we're trying to achieve. We're trying to promote mental health and well-being and prevent mental health problems. That's the context that I was talking about before. We're trying to improve the care of people who are experiencing mental disorders that have an association with suicidal behaviour. Improving the care of people who make non-fatal attempts. Reducing the access to means for suicide. Promoting safe reporting and the portrayal of suicidal behaviour by the media. There still goes a ways to go in that space. Support families, whānau, friends and others affected by suicide or suicide attempts. Remember that someone who has a loved one who has committed suicide is actually a much higher risk themselves of actually making attempts. So intervening in the postvention space is really critical. and expand the evidence about rates, causes and effective interventions. So the Suicide Prevention Action Plan was, as I say, launched in 2013, and the rationale behind this is that we need to build on where we were before and to move further forward. Some of our existing initiatives have been very effective, and we want to preserve and maintain those. Many, however, have been relatively small scale and are only available in certain locations, so we needed to address some of that and to expand where things are working as best we can, and also look at some of those other initiatives that we need to flow through. A key focus in the new plan is to boost existing services so they are available to families, whānau and communities when they need them. And as I say, a range of stakeholders were involved in this. But this can't be done by health, and it can't be done by any one agency by itself. Now, the slide that you have up there is really just to show you some of the governance, but also to illustrate that this is a collective action by a number of government departments. While the Ministry of Health forms the lead in this activity and funds the bulk of the suicide prevention services nationally, nevertheless, we can't do it without our partners, and we can't do it as government agencies without the community supporting us. The current chair of the Ministerial Committee on Suicide Prevention is the Honourable Todd McClay, who is actually the Minister with delegated responsibilities in this space. We have an interagency committee to look at it, as you can see, the Committee on Suicide Prevention, and that's now meeting regularly to try and make things happen as distinct from just produce a nice plan. This is a plan for action, not a plan for planning. So just to talk about some of the actions. So there are 30 actions across those 8 key government agencies. And if you go through the plan, you'll see that this is a multi-level focus. It includes working in partnership with communities and working across service agencies and across government. That multi-level process is critical because no one action, as we were just hearing from the previous speaker, will make a difference in and of itself. And we actually have to work at all levels to make a difference. And as you can see, there is an investment of 30 million over 4 years. So just to now look at some of the aims in terms of this plan, there are a number of things which we need to address within this plan. And so I'll just go through this to actually emphasise it. I know you can read it, but I just really want to emphasise what are we trying to achieve for the next 3 years. So we're wanting to address the impact of suicide on family, whānau and communities by strengthening the support for them. We're trying to build the evidence base, but specifically around what works for Māori and Pacifica. That is something which we uniquely need to tackle in New Zealand. We extend the existing services, specifically addressing geographical gaps in the coverage of services, so that, again, we think about what we need to do across the country. We're going to do some innovative trials in terms of the use of social media as a prevention tool. Much has been made about social media as a cause or a potential trigger for suicide. Well, let's see if we can turn it around and use it in a more effective way. And strengthen the suicide prevention targeted towards high-risk populations who are in contact with agencies. So you will see in the plan stuff to do with what, for instance, Department of Corrections was wanting to do within prisons. It's really about looking at how do we target those groups which we know have higher risks and that we have some governmental responsibility for. So let's just spell this out in a bit more detail. As we said, there is those 5 objectives, and I just want to break these down. For instance, this first objective, which is around families and whānau, hapu and iwi, trying to prevent suicide within those areas. First of all, we actually think we need to do some capacity building, and you'll see that that's one of the actions which we were doing. We also need to ensure good quality information and resources on suicide prevention are available, and actions in this area will include some of the things about getting the right information to those who need it and providing DHBs with guidance around specific best practice and disseminating, preventing and responding to suicide resource kits to schools. We're training community health and social support services and staff across the board in terms of recognising mental health issues and recognising the risk associated with suicide. And there are some innovative extensions of the MH101 and other sorts of frontline gatekeeper training which will be flowing out to various gatekeeper services. So the second objective is to support families, whānau, hapua, iwi and communities after suicide. And covering this is a range of actions, including ensuring the range of accessible support services available to families, whānau and others who are bereaved from suicide. Remember, we are concerned that if you are in that category of someone who is in your immediate circle who has suicided, that you actually are at increased risk. And so that there is expanding the initial response service so that it is available nationwide. At the moment it has only been available in some areas. We're also looking to support communities to respond to following suicides, especially where there is concerns about suicide clusters or contagion. And that increases the capacity of CPRS, the Community Post-Vention Response Service, to actually provide better guidance to those communities. We have some unique characteristics of clusters in this in New Zealand, and really we do need to intervene in those. Now, having been involved in some of those interventions, I can tell you that where there has been a collaborative effort and where there has been concerted effort, we have been able to make a difference and stop the cluster expanding. So it is worth doing. The third objective is around improving services and support for people who are at high risk of suicide and are receiving government services. Now, I've listed a number there of, extracted from the plan. So what are we going to do? Well, this looks like actions which we are going to do in terms of training primary care health practitioners to improve care and follow-up for those who are presenting to emergency departments, enhanced or specialist training for relevant staff, social workers and carers to strengthen suicide identification and assessment. And as I said before, some of the stuff which Corrections is doing in terms of screening and starting to address some of the issues to do with suicides and suicide attempts within prisons. Mentioned the social media. We're really trying to look at how we can develop an initiative in terms of monitoring and responding to suicide contagion on social media sites during a suicide cluster. That's in the early stages of planning, and also looking at how to reduce cyberbullying to maintain the availability of information, tools and resources on good cyber citizenship and reducing cyberbullying. The fifth objective is really around the infrastructure for suicide. So in the plan you will see that we're looking at trialling a suicide mortality review mechanism. We do collect suicide information, and I certainly see most of the coroner's inquest findings in terms of suicide, but we want to be much more systematic about that so that we can actually start to learn about what is happening within the New Zealand scene in terms of suicidality. That's a non-trivial task, I can tell you. Establishing a function to analyse and share up-to-date provisional coronial data. This has already been commenced by the Chief Coroner, and a number of DHB suicide prevention coordinators are benefiting from that sharing of information so that we can start to get in ahead if we start to detect clusters and start to move. And also developing a suicide prevention outcomes framework. It's important to know what we're doing and how, whether or not it makes a difference. We need to contribute to the overall data. Just want to move away from the plan itself and just give you the sense that this is not in a vacuum. On the overhead, you can see that this fits within a number of whole of government initiatives. And you'll say, well, how do some of these fit with suicide prevention? Well, in fact, a number of those actions of government are actually tackling some of the significant drivers and distal causes that might lead to suicide. Just want to remind you that we have in this country the National Depression Initiative, including the Journal, Lowdown and support lines, which I think is world class, and I think that that has indeed made a significant difference. The earlier speaker spoke about some of the stigma in terms of people presenting, so the Like Minds Like Mine campaign, for instance, actually fits within assisting people to get to the point of help seeking so that we can make a difference in that space. As I said to you last year when I presented, the Prime Minister's Youth Mental Health Project has a number of initiatives in a collaborative way which is designed to actually make a difference to the mental health and well-being of young people, but by doing so, that also sets the scene and platform for us to start to address some of those factors that might lead them to start taking their lives. We, as a ministry, also sponsor programs around parenting. We fund both the Triple P parenting program as well as the Incredible Years. Again, programs designed to actually start early and start to reduce some of the problems that lead young people to developing problems. There are a number of other programs which will be starting to roll out in terms of the Children's Action Plan, again targeting vulnerable children so that we can start to make a difference. And the whānau ora approach is important because this focuses on the whole being and well-being of whānau and developing capacity to resolve their own issues. So I haven't gone through all of them on the slide, but just to give you a picture that from a government's perspective, we see these things as mutually supportive as well, but we're not saying it's suicide prevention per se, but nevertheless, from my perspective, it makes a big difference in terms of what we're trying to do. Just want to mention one other aspect that we are focusing on. For those of you who are in the more specifically in the mental health and addiction sector, you will remember that we launched in December the government policy document which is called Rising to the Challenge. This again is looking at how we develop our services as a whole across the country in the mental health and addiction sector. And some of the components within that in terms of the improved primary-secondary integration and some of the other parts in terms of making a difference to those people who have significant mental disorder will make a major difference in the suicide prevention space. All of these we're trying to, within the Ministry of Health, pull together, and we have program coordinators who are actually trying to draw the links so that we can help you, everyone I hope in this room who's wanting to make a difference, find your part within where you need to work. Which brings me on to my next point. Excuse me. Successful suicide prevention really does require a multi-level and multifaceted approach. There is no one magic bullet which we can use. It must cover prevention, early intervention, treatment and postvention, and it does require a long-term and sustained commitment. And that's what government is doing. Oops, what have I done? Wrong button. And the strategy and the plan by itself is not really going to make the difference. It really does require the collaboration of individuals, families, whānau, communities, agencies, right across New Zealand. We need to make this everyone's business. This is not just a government's business, it's not just one organisation's business, this is our collective business about making a difference for our fellow New Zealanders. For instance, health services cannot prevent suicide on their own, as a large number of suicides are by people who are not in touch yet with services. And I can tell you, reading a number of the coroner's inquest findings, that is very clear. As such, a key focus on efforts over the next 4 years will be on further strengthening the links between people and organisations, including families, whānau, communities and agencies. We really need to get those links working so that everyone can play their part. People and organisations need to work together for suicide prevention to be successful. And the last point, I think, is what I really wanted to start with, which is that everyone has a role in suicide prevention. While some agencies and some positions, such as mine, may have a more prominent role, it is not something which we can all do without others engaging with it. It isn't a role for government, it isn't a role for the health, it isn't a role for MSD or whatever, it is a role for every one of us to play our part and to see how we can make a difference to those who are affected.